Thank you for checking out Dr. Christine Greves' website. I'm sitting down with her today to talk about all of your most important questions about the female body. So let's dive right in. Dr. Greves, I know this is probably a question that you get a lot in the privacy of your office, but a lot of women might be wondering, what should I do if my partner has been unfaithful and I'm concerned about STDs?
There are different types of relationships, exclusive or not. And if you discover that your relationship is not mutually monogamous, meaning that if you're not in a situation where you and your partner are only with each other, but you thought that was the case, then you may be genuinely concerned for your health. So when that happens, pick up the phone, go see your OBGYN, and here's what we're going to tell you, okay? We're going to tell you to take some deep breaths. It's going to be okay, that we're here for you, okay? And also, we're going to want to perform an exam on you. We're going to ask you if you've noticed anything different about your private part area. Have you noticed any fever, pain, anything different about your body, any new discharge, and any new lumps or bumps or anything like that down there, okay? We're gonna ask you those questions first. So just try to think about that if you've noticed changes about your body. We're also going to wanna perform an exam on you. So we'll look, we'll evaluate, we'll take some samples of different things and send some tests out. And then we'll also wanna check blood on you. What we'll do when we check the blood is we're going to check for certain things like, HIV, hepatitis C, syphilis, okay? Because those are some infections that you can get with sexually, and we will want to check that. There is something called a window period for HIV, hepatitis C, meaning that at the time that you're drawn, it may not be positive yet because it does take some time for your body to form a response to that. So we typically tell you you'll need to have your labs repeated again in a certain time frame. It depends on the test that's run, so it could be anywhere from four weeks to 6 months later as to when you need to get that lab repeated. As far as the samples that we check in your private part area, we'll check for gonorrhea, chlamydia, trichomonas, and just try to make sure everything's okay. And if something is found, we'll walk you through that as well, and we'll get all the necessary help for you. And just take some deep breaths, and you'll be okay.